guys, I'm Dr. Ganeshwari Raikar and today we're going to discuss a new case of ABG. If you are new to my channel, this is Dr. Ganeshwari Raikar and this channel is called Newbie Doctor, where we discuss every day a new case, and this is our third case in the ABG series, which is quite nice compared to the amount of procrastination I do. And before getting into all of that, let's start our case. So we have a 24-year-old female who is G0P0 in her first trimester, coming to the emergency department with acute dizziness, hypertension. She says she has severe morning sickness and she has been vomiting, not being able to retain anything in her stomach. Okay, so far she has tried her oral antihypertensive. Did I say hypertensive? No, oral anti-emetic medication, and it's not been helped. She's tachycardic, she's tachypneic, she's hypertensive, saturations are fine, started on DNS. And ABG in the ER shows the following values. So her pH is 7.54, her carbon dioxide is 40, her oxygen her oxygen is 110, and her bicarb is 38. Now the question is, what is her primary disorder? Is it metabolic acidosis, metabolic alkalosis, respiratory acidosis, or respiratory alkalosis? So we know that with vomiting what happens is you throw out a lot of your stomach content, and what is in your stomach? That's digesting food along with your pepsin. It's HCl. So you're throwing out a lot of acid. There's a drop in your acid and there's high amount of alkalinity. That's why the pH has now increased. Now we're going to look into our 3 steps of diagnosing. Step number 1, to look at pH. That would 7.52, which means it is alkalosis, right? Step number 2 is to look, bicarb is clearly high, it's 38. Okay, which means it is alkalosis, metabolic alkalosis. Now the third step is to look at carbon dioxide. Now to compensate, you're going to expect the carbon dioxide to be either in its lower levels or at least within normal range. In our case, we'd say that it is within normal range. So what is our primary disorder over here? The primary disorder over here is metabolic alkalosis. So I hope this case was easy and you understood how to diagnose metabolic alkalosis. Okay, I'll see you in my next case. Till then, adios.